Hey, my white belt ninjas, it's time to open up those hips. Let's do this. So the first thing we're going to do is you're going to sit on the foam roller, you're going to cross that leg and whatever hip you're going to work on, and then you're going to roll up and down on that glute area. We're going to work the piriformis glute med area. And whenever you're rolling, that's the scan. You're scanning for a trigger point or a painful nodule. Then you're going to stop on that painful nodule, and then you're going to bring that knee up and down, try to dig that trigger point out of there. It's called a pin and stretch technique. And then when you're done, just kind of roll around again, see if there's anything else. Next, we're going to lay on your side. You're going to do your IT band. Start at the top part of the hip, go about a third of the way down. Same thing, just be careful just to roll. This is sometimes pretty tender on the side of the leg. Then while you're here, just roll forward, and you're just going to get the top part of your quad or your thigh muscle. There again, you can find that little trigger point area, stop, and then flex and extend that leg. Then you're going to go back to the mid part of the leg, work that IT band again, roll up and down, and then roll forward to get that middle part of your quad. Here's another pin and stretch technique. Last, you go to right above the knee, because your IT band runs all the way from the top part of the hip all the way to the side of the knee, so make sure you don't forget this part. And the top part of that knee there, the top few inches, gets pretty gnarly and gunked up myofascially, so definitely focus on that area, especially if you're having knee pain. Next will be to go to the calf area, or your soleus or gastroc. And you're going to use your other leg in your hands to pick your butt up off the ground, and you're going to roll the meat part of the calf and down to the Achilles. Make sure you get the inside and outside areas of the calf muscle. If you want to apply more pressure, put your other leg on top, pick your butt up off the ground with your arms, and then roll slowly to find that knot, and then do the pin and stretch technique by pushing and pulling that foot up and down, dorsiflexion and plantar flexion. Next is the couch stretch to open up those hip flexors. You're going to put your foot on top of a couch or a chair, put the knee down. If you want to make it a little bit easier, bring the knee away from the foot, tuck the butt underneath you, and go forward only at the hip. If you want to make it harder, bring your knee closer to the foot or the couch that you're stretching on. Then if you want to stretch your ankle, since you're here, you want to let that knee go about 4 inches in front of the toe and keep that heel on the ground. Make sure that knee is going directly over the middle part of the foot. But if you do not have a chair, just put your foot on the ground, engage the toe, tuck the butt underneath you, and lean forward at the hip. You can also work on external rotation of the hip while you're in this position and internal rotation of the hip at this position. The principle applies the same. Tuck the butt underneath you and try to stretch just at the hip flexor and not arching the back. Next will be to lay on your back, pelvic tilt to flatten out the back, let the back arch, pelvic tilt, keep the chin tucked, and work on your breathing. Are you able to hold this position?